going to be doing exercise to treat a functional scoliosis. So this is for scoliosis where your hips are shifted to the right and we want them back to the left. So we're going to go ahead and put our left shoulder against the wall, and you're going to let your hips fall to the wall to push it back in alignment. Now we're going to just hold it here, and we're going to just practice taking deep breaths in. So take a nice deep breath in here, deep, 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 deep breath. And exhale. And deep, deep, deep breath in. And exhale. So this is going to help to stretch out the diaphragm that attaches into the lower part of the back. Deep breath in, really stretch it out. And exhale. You're doing a great job. And now we're going to put our hips back straight, and we're going to do 5 in total. So against the wall and back. And against the wall, so we're starting to strengthen a little bit here, our core and back. So touch the wall, back, touch the wall, and touch the wall. Now we're going to raise our arm up. So try to reach up towards the ceiling with both arms, really try to reach up and let your hips touch the wall. Take a deep breath in and really try to stretch up towards the ceiling. And exhale, and hips back up, and we're going to do 5. So that was 1, 2, 3, 4, and 5. Good, arms back down. And now we're going to use our bottom leg, step towards the wall, and push yourself back up nice and straight. Now we're going to move to the floor, and we're going to work on our mid-back. So we just worked on our lower back, now we're going to work on our mid-back. So hands behind the head and try and tilt to the left side. To bend the curve we have going on to the right, back to the left. Take a deep breath in and exhale. Again, we're trying to stretch the diaphragm, stretch out the muscles that are tight. Deep breath in and exhale. Good, back up. And again, back. Again, back. 3 more. 3, 2, and 1. Reach up towards the ceiling. Deep breath in, really try to reach up towards the ceiling. Imagine your spine super, super straight. And now lean to the side, so you can clasp your hands. Lean to the side. Try to touch the wall next to you if you're sitting next to a wall. Good, sit up nice and tall, and you're just moving in your mid-back. We're starting to strengthen around the spine and also stretch out the side that is tight. Now let the arms lower. We're going to move on to lying on the floor. We're going to work on the rotation now, not just the side bend. So we're going to use our left arm to cross your body and try to reach for the right arm and come back. And try to reach for the right hand and back. Keep your arms nice and straight. Reach for the right. Really try to reach for it. And down. Really try to reach. Try to get that shoulder off the ground as much as you can. And hold here. And back down. And again, gonna reach. And down. Again, really reach, 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 reach. Back down, arms straight. Try to get that shoulder off as much as you can as you reach. And hold, 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 hold. And release. Now you're going to want to make yourself like a pencil. Really straighten yourself out. Try to imagine someone's pulling your wrists and then pulling your ankles in the opposite direction, and you're really lengthening your spine and you're getting very, very tall. Keep reaching, reaching, reaching. Bring your belly button right to your spine. Suck it in. And relax your arms out to the side. All right. So now we're going to do cat and camel. So that means you have to get onto all fours, and the first thing we're going to do is tuck everything into it. Try to bring your chin to your belly button. And now you're going to squeeze everything back, stick out your butt, and look up towards the ceiling. Again, try and tuck that chin towards your belly button, squeeze everything in, and look up towards the ceiling. So we're going to do this 8 more times. We're going to do this a total of 10 times. Almost done here. And look up towards the ceiling. Now we're going to get a towel, and we're going to, it's just a hand towel, and we're going to fold up the ends like this. So it should look like this, okay? So when you put it on your back, your spine is going to be the 2 round ends, okay? So you're going to place this right in the middle of your back where you see the curve. So see where the towel is right on the curve? That's what we want. So you're going to lay right on top of it, and you're going to hug your knees into your chest. Okay, squeeze it nice and tight. What we're going to do is just breathe here for the first few seconds. If this is too much stress on your knees, you're going to just grab underneath your knees and grab the back of your hamstrings. That will take some stress off the knee. We'll just keep taking deep breaths here, in through our nose for 5 seconds and out through our mouth for 5 seconds. Now you're going to try to reach your toes up towards the ceiling. Really try to reach. You're going to feel a little bit of a stretch. And back down. If you need to, you can adjust the towel as I'm doing here. Otherwise, just stay in this position here and take deep breaths in. And you can reach over even more if you can. You should not be experiencing any pain whatsoever. You should just feel a nice gentle stretch. What we're doing is just trying to get that area in our spine to just come and fall and just have a nice stretch into the deeper ligaments of the spine. And grab your feet if you can, bend your knees, bring them close to your chest. Remember to inhale and exhale. And relax in this position again. Hug your knees to your chest. Keep breathing in nice and deep, in through your nose, out through your mouth. And reach up again. Great job. And now we're going to stretch like a pencil. Try to really reach out. Reach with your hands. Deep breath in. Really try to stretch that diaphragm and that back. And release. Thank you for completing this video. This is something that you should be doing daily to really experience the full results of this. If you've been experiencing this for years and years and years, like most people do, then you almost have to equate for every year you've had scoliosis for a month of doing this daily. So if you've been suffering from this for 12 years, you have to expect at least a year to start noticing some sort of results. Take monthly pictures so that you have a comparison of what's going on. And if you have any questions for me, please leave that in the comments below. And don't forget to subscribe. Thank you very much for your support.